Hello and welcome back again to Spine and Rehab Specialists for another Wellness Wednesday. I'm Earl Hayden, one of the physical therapists here, joined again by Chris McMillen, and today we're going to show you 5 different exercises that you can start with if you've just had a total hip replacement, and this is if they did a posterior hip replacement, so that's where they do the incision somewhere more from this back end over here instead of the front. Alright, so the first thing we're going to show you is a heel slide, but one of the most important things we have to remember with this type of surgery are some of the movement precautions. So we want to make sure we don't cross the legs over, we're not bending the hip or bringing the knee up past like 90 degrees, and definitely not turning the leg inwards like that. But otherwise we can go backwards, we can go out to the side, and we can turn the leg out fairly safely. So getting into this position, we're going to lay down. So if we need to, grab a pillow, kind of fold that between the legs, and then from here we're going to lay down. Okay, and the pillow's there to make sure we don't let the legs touch. We have to keep them apart because we're trying to protect that repair. So once we're here, we can move this pillow out of the way. Now we're going to do an active heel slide. So I'm going to put this little pillowcase around Chris's foot, or you could just do this barefoot, you're on your bed, or just have some sheets. We're not going to do a forceful stretch, and all he's going to do is push his leg out, just letting that foot slide on the table there. Okay, just contract those muscles, so tighten those quads. Just try to learn how to use those muscles again, and then bring the leg back. So just bending the knee, pulling through the heel, using these hamstring muscles back there. And again, we're not going too far because we don't want to bring the knee past this point. So you don't have to go too far with that. A good 20 repetitions of that, maybe 5 to 10 second holds on each end, just getting a good stretch at the knee and make sure we're not getting too tight around that hip, and make sure we're just trying to learn how to use these muscles. Next thing we're going to do is just a simple clamshell exercise, which we've been showing in other videos. But the twist is, again, we can't let the knees touch. So again, with our handy dandy pillow, some surgeons give you like a post-op foam kind of thing that's shaped to the knees. We don't have one of those here, so we'll use this instead. Okay. So Chris is going to lay on his side. All right. And in this case, we're going to say that his right side is the surgical side. The movement's the same. The knees are bent almost like 90 degrees. We're not bringing the knees up too high up this way. Toes are pulled up, cushion in between the knees, and then we're just lifting up the top knee. And if you need to, you definitely wedge the pillow in just a little bit more, or you can turn it sideways to make sure that that pillow doesn't fall out of the way, or you just hold on to that if you just want to make sure it doesn't fall. Anywhere between 10 to 15 repetitions should be good, 2 to 3 sets. Once this gets really easy, definitely do a longer hold, maybe 5 seconds or even 10 seconds. And you can still add some resistance onto this. Again, let the discomfort be your guide. And of course, the main thing is do not let the knees touch. Okay, the next exercise we're going to show is the bridging. So again, keeping that pillow here, Chris is going to roll onto his back. So we're going to be face up or supine. All right, and then from here, we can move the cushion out of the way. Have the knees bent just a little bit more, almost like 90 degrees, and then squeeze in the glutes, get a good clench, and then lifting up the hips. All right, so we can hold that for a good 2 to even 10 seconds if you're strong enough, and then anywhere between 2 to 3 sets of 10 to 15 reps should be good. If this is pretty hard for you, you can lower those repetitions, and some people might have some difficulty with it. So anywhere between 5 to 8 is fine if you're just slowly building this up, or especially if you just got out of the surgery and you just want to slowly kind of ease your way back into doing some of these movements. Well, next thing we're going to do is just a basic table squat. So Chris is going to roll onto his side here, and then we're going to sit on up. And again, the main thing is we have this pillow here to make sure the knees don't touch. And now once we're sitting, we can go ahead and move this out of the way. Now, squatting is a challenge after the surgery because again, we don't want to really bend forward. Normally, we do this number when we squat. We kind of get that forward lean, but we have to avoid that. So the way we're going to do that, let's say the surgical side is the right side. What Chris is going to do, he's going to have his leg out a little bit more, okay? And then from there, he can use his hands to help standing up, putting more of his weight on this left leg. And then from there, stand up. So by doing that, by keeping the leg out, we're not going to go into too much flexion here. Even if you really need to push hard with the arms to avoid that type of bend. After a few months or so, or once the doctor gives you clearance, you can definitely go back to bending a little bit more forward, as long as everything is stable there in that hip and we're not having any problems. So this is one of the most important things you have to practice. I say anywhere between 5 to 10 repetitions. Anywhere between 2 to 5 sets should be fine. The last exercise we're going to show you are standing hip exercises, and the main thing is that even here, we want to make sure the knees, the legs are not touching. So if you need to, you can have something in between the feet. We can put a little ball there, I know the cushion. So I'm just going to put this little ball, just to act like a little marker for Chris, so we know that his feet are not going to touch. Okay, so the first exercise we're going to show is lifting the legs out to the side. So this is a straight leg hip abduction. And Chris is just going to lift the leg out and then bring the leg back in. Again, main thing we're looking for is his body is nice and straight. He's not doing any weird leaning. And the ball is right there just to make sure his legs don't touch. If this gets really easy, you could definitely do a longer hold or even add a little bit of weight onto this. Anywhere between 10 to 15 repetitions should be good. Now, another exercise we could definitely do from here is extension. So just bringing the leg back. And again, trying to keep everything nice and straight, not leaning forward as we do this. So all the motion is coming from the hip, all right? We can even do a straight leg raise to the front, which would be better than doing a march or something like that, because again, we're trying to avoid going too much into that hip flexion angle. All right, again, anywhere between like 10 to 15 repetitions, 2 to 3 sets should be good. You can definitely do this on both sides. That way also work on putting weight on the injured side. Right. And those are 5 different exercises you can do if you've just had a posterior total hip replacement. So make sure to join us tomorrow for our Thirsty for Knowledge Thursdays, where we're going to go over more about this type of surgery, how it happens, and more about how we can help you with that type of surgery and other similar injuries here at Spine and Rehab Specialists.